Hi, welcome to episode 4 of the Kural podcast. We've got Kainika and Lance. Lance, do you want to introduce yourself?
Thank you so much for having me, guys. My name is Lance. I've just finished my DFT and doing my DCT in a joint DFT and DCT scheme. So nice to meet you guys.
Okay, so I'm sure some of the listeners would know who he is already, but you're quite famous on social media.
I wouldn't say famous, but we're just around, we're just started social media and some of the videos get out there and get views. But yeah, I wouldn't quite go to say famous just yet.
And what made you kind of go into social media in the first place?
I think that's a really, really good question, to be honest. So I was never really into sort of social media as much. My best friend at the time was making social media content, and most of the time it was just like self-improvement content. But the reason we couldn't do social media dentistry wise was because it was prohibited in our dental school. We couldn't, film in scrubs. We couldn't film, any of the sitter work that we do where we're working on phantom heads, obviously not clinic. So there was never really an opportunity to do it. So we came to year 5 and we were obviously all banging out at the end of year 5 to try and get honors. And I said to my best friend, like, when the results come in, if I managed to somehow get honors, which I thought was very, very rare, hard at the time, I'll go and get a new iPhone 15 Pro Max and I'll start filming myself. So it came about, I think it was June 15th or something like that, 2024. I got my BDS results and I got honors for BDS. And on that day, I went and bought an iPhone 15 Pro and I've been filming. And we're about a year and a bit on from there. And that's how social media sort of began.
Wow, that's actually a really cool story. I love how it all started off in like a bet kind of way. So,
Yeah.
what do you do on your social media? What is like your go-to content?
So when I started social media, I was obviously going to just do it around Dr. Lance. It's just who I am, what dentistry is like, what dental school was like for me, any tips and tricks. And we've sort of progressed on from that a little bit in terms of now sort of doing dental work as per se. But I think I found quite early on, a lot of people, dental students, were asking for a lot of advice in terms of how did you do well in dental school? What were the challenges? What would you say, has helped? So I kind of made that as a bit of content, but I always felt like I had to be to myself. You can't make something just for the sake of making it, or like something that you don't enjoy doing, because then you won't stick to it as much. So right now it's really tailored to just dentistry as a whole, what I get up to in terms of lifestyle. And I think slowly transitioning into sort of fit couple of niches is my goal. So mostly I would say lifestyle, dentistry, and just self-improvement, just getting better as a person is where I'm at the moment.
What's your number one motto?
Number
Just
one motto.
yeah.
That's a really, really good question. I think I had to think about that a little bit. You guys give me a bit of an idea of what your guys' motto is, or what I think.
I'm a
I
very
think
Clearly,
much like everything happens for a reason. Like that's
yeah,
my motto in life. Like anything bad that happens, anything that doesn't go my way, I'm like, there's surely a reason for it. And in the future, I'm gonna look back and just think like it's all fine. Like this actually led me to where I am in the future and hope it's in a good, successful place.
I'm sure it would be.
yeah, that's a really good one. Go on, Michelle. What's your one?
I think mine is kind of like life is what you make of it.
Yeah,
I'm sure, okay, so I'm assuming a lot of us come from working class family and the whole Sri Lankan civil war, blah 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 blah. So obviously there's been a lot of adversity in life. But I think for me, when I see people moping around about the cards they're given and they're not actually doing anything about it, that kind of frustrates me. So I think I'm fired up with, okay, there's adversity, there's challenges. Let me see what I can do. I think that's what kind of keeps me going.
yeah, absolutely. Yeah. I think for me, I would say is like anything's possible. I always have this mindset of thinking like,
Mm.
if no one else has done it, I'm going to be the first one to do it. If other people have done it, why can't I do it? And I've always had that mindset growing up and evolving as we go through. So I think that's really helps me. And I think that's something that I always stay with in terms of if no one's done it, I'm going to be the first. If anyone else has done it, I'm going to be the next.
Would you say that you had that kind of mindset during GCSEs, A levels, Blindfold Dental School, or do you think that's kind of, as you've gotten older, you've got more experience in life and that's
Yeah, I think that's a really, really good question because I look back at my time in GCSEs and A level. GCSEs, I did well. I got A stars and A's, but I think when we transitioned into sort of A levels, I was really, really playing a lot of video games and I thought like I'm gonna go pro on video games. So we got to around year 12 on Call of Duty, and I'm playing for money at this point. So I'm playing for a bit of money on Call of Duty. At that time, you're doing a wager for, say, like £5. And at that time, when was this? Like 2016, 17, you're thinking £5 is a lot of money that you're wagering. And obviously, your amma comes in year 12 and goes, so what do you want to do with your life? I'm saying, I'm going to go professional in Call of Duty. I'm going to become a gamer. She just gives you that look, like, what are you doing with your life? This does not exist. That point is where I sort of transitioned into, okay, I need to do well to get 3 A's. And funnily enough, in my February mocks, I got E in my biology, got
I got
C,
saves.
I got C in maths, and I got D in chemistry. And I was just like, this ain't gonna cut it. Like, I'm never gonna make dentistry. And I was like, what can I do? And I was like, I have to make this dream happen. And like, so many other people have gotten into dental school. And obviously at this time, I never knew anyone that's gotten into dental school. Nobody in my family is gotten into dentistry. So I was like the first one trying to navigate through a path that I've never seen. And it's just like, I did 65 past papers for biology before, like, leading up to the exam. I did every single thing that was possible because I was like, I'm going to get this A. And I think that's sort of where I've done it once now. So once I did it for A level and GCSE, I thought I'll take this with me. So, but yeah, I think never been like crazy sort of studious or something, but I just always thought I had the hard work to get there.
So when did you transition from Call of Duty Pro to wanting to be a dentist?
Well, I wasn't pro in Call of Duty. I would say it's sort of like playing for just a bit of money. I think year 12 or year 11, I would say, was where I was playing video games, and I thought, I'm getting pretty good at this. I can definitely take this seriously. But I think you have that period where you spend a lot of time playing, dedicating something to this skill. And then you think, well, I can't. I've got to now transition to, can I make money from this? Or do I need to do something else? This is not a hobby anymore. When you're a kid, you're playing, it's all fun and games because you've got school and everything. But like once you get to 18, 19, if you're going full time, you need to make money from this. And that's where I sort of had that transition after GCSE was like, well, do I go full time, creating content, playing video games, or do I go down the studious path? And as we all know, we all have Asian parents. I don't think a career in social media or career playing video games exists. So that's where that transition sort of came in. And that's where I got into sort of getting into dentistry.
What sparked your interest in dentistry?
I think dentistry is one of those things, typical Asian parents, you want to do medicine, dentistry, law, or engineering. I think I've always felt like I wanted to do something healthcare related. But in all honesty, I felt that I was really, really good with my hands. I did quite a lot of arts growing up, quite good at drawing. So I thought manual dexterity, played instruments was something. And I just thought, in terms of looking at the long sort of lifespan of my career, I think dentistry just has a way better work-life balance. And, medicine is an amazing career, but overall, I think dentists, if you speak to most medics, they will swap their jobs to be a dentist. I've spoken to so many medics who say, I wish I chose dentistry. I've not spoken to many dentists who've said to me, I wish I chose medicine and I became a doctor. So there you go. That's where it is at. So I think for me, with all my skills sort of combined, I thought dentistry was probably best suited for me. So that's where I've ended up.
Okay. And like, did you do any kind of like work experience or like to
Yes.
consolidate?
Yeah, I did work experience was another nightmare to get back in those times. Like,
Yeah.
we had to call up like 10 different practices, please. And they're like, no, we can't accept people because we're private or because of indemnity or et cetera, et cetera. And then my dad, through a family friend, through blah, 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 found someone where I spent 3 days to a week doing shadowing a GP, general dental practitioner. And to be honest, I just saw him, didn't know what was going on at the time. He was just doing general dentistry. So I think that didn't really give me that much insight into what dentistry was like. But I did quite a lot of work experience around medicine. So I did like St. George's, bite-sized healthcare course and all these extra stuff for medicine. And I thought doing that and combining that with a bit of dentistry work experience, definitely thought, I don't really think medicine is for me. So do you just kind of cancel out what you think is not for you? And dentistry is where I was ended up.
What would you
Cool.
say was the hardest part of your whole application process?
I don't know about you guys, but I'm intrigued to hear what you guys said. But I personally found UCAT the absolute hardest. I thought that was a demonic exam. It's horrible. Like, I absolutely hated it. One, because I didn't know much about it at the time I was applying. I just realized, oh, it's an exam that you have to sit. And then preparing for it, I don't feel like I had enough time. And for everybody that says you cannot prepare for your UK exam, you definitely can. And there are so many resources out there where you can practice, which I didn't know at the time. So I would say that was for me the absolute hardest, because the verbal reasoning part I found so difficult. Like how quickly you have to read, how quickly you have to sort of skim read and answer the questions and move on to the keywords or whatever. But for me, I thought UCAT was the worst. And I think I wouldn't even bullshit on the worst in terms of my enemies or anything like that. I would never want to do that ever again. So I think UCAT by far, that scarred me for life. Never ever go back to that exam again.
Yeah, I've got to agree
What
with
about you
that. I
guys?
think the UCAT was the hardest part, especially because I feel like, in my opinion, I think it is quite luck based, which I think is just horrible. Because like even if someone like has done all the hard work they can and they put so much effort into it, they may still come out not with the score that they want, which I just think is just not ideal. Especially because I think that is the part of the application process that does eliminate a lot of the applicants. So yeah, UCAT has to be the worst. I still I can literally pinpoint to the morning of my UCAT and the anxiety I felt, like me on the train ride, literally like sweating. Yes,
You're
not the
scarred from
vibe.
it too then.
Yeah.
What
Yeah.
about you, Michelle?
I think for me, like, what? So we're talking like 6, 7 years ago, right? So there wasn't as much resources back then as there is now, I'd say. I remember like actually having to reschedule my exam because I think like a couple of days before the exam, I literally was like, yeah, I can't. Like I had a full on breakdown. Because the thing is, like, as much I was doing like at least 100 questions a day for like a month and a half, and I still didn't feel prepared. Because yeah, it is about pattern recognition, but okay, for me it was maths. Like I'm rubbish at maths. So like the math stuff was just not making sense to me. And like because if you score low in one, you kind of have to get like high in the other. Yeah. So yeah, UK
Yeah.
cat.
Yeah.
That's also scarred me. Yeah.
So Lance, you mentioned that you are president of the Widening Access Society. Can you tell us a bit more about that?
Yeah, I think this is something that I'm like extremely passionate about. So when we were in dental school, there was an opportunity for helping students that were from underprivileged backgrounds, which came about in year 3 of my time in dental school, and sort of took over the presidency over there. And year 3, year 4, year 5, I ran that in terms of helping dental students. So when we initially started, we was just a team of us 6 and working with the actual admin team and the widening participation team at the university that I was in. And we were running, say, UCAT sessions, MMI sessions, and helping people with the stuff that I would have wished I had, and doing like, say, a week of work experience for these people that would count towards it. And then it sort of grew and grew and grew, and the vision became bigger and bigger. So then we were able to do something where if these students are from underprivileged NHS background, then we would be able to give them a participation sort of tick in terms of getting a contextual offer to get into university. And that sort of expanded into the 4th and 5th year where I was at, where we were able to get funding from the NHS Dental School Council to be able to do a residential summer school for these students. So for them to stay with us for 4 nights, and we were able to fund all of that to be able to send, do a session, what we would like to practice on phantom heads, go through lectures that we went through, live the university experience for these students. And I thought it was such an incredible opportunity. And it was so nice, helping all of these students, because when you're there in year 3, and now when I was out on year 5, and now, so all of those, most of those students now have messaged me saying I've gotten into dental school, or like I'm at the dental school that I'm in. And I think it's an extremely rewarding thing, because you've made an impact on their lives to get into dental school. You helped them achieve their dream. And I think that was very beneficial for me to sort of look back and think that was so helpful, because we never had those resources. I don't know about you guys, but I didn't know where to practice UKCAT. I didn't know how to help people with interviews. I didn't know what dental school was like. I never even went to see a dental school when I was applying. So being able to provide that experience for other people was super helpful, and obviously taught you a lot of skills and stuff as well. So I was just super grateful to be able to have that opportunity.
Okay, I have a question for people who are considering to do dentistry. So it's like I think it's been voted the #1 most competitive course right now.
Mm.
What would be your best tip? Like, yeah, we get you need to get good grades, all of that
Yeah.
jazz, but I think, like, would you agree that a lot of applicants are going to have kind of the same baseline?
Yeah. Yeah, absolutely. And I'm always blunt whenever the people ask me this. If you're not good enough, you're not going to get in. If you don't have the right mindset, you're not going to get in. Like, the people that you're competing with are all, like we said, the baseline. Everybody, like, what this is one thing that I noticed when I got into dental school was like, oh, you may be the best in your school, but when you get to dental school, you're not the best anymore. Like, everybody there in that pool were also best in their school. So you're at this baseline where you need to build those good habits. So I'd say like consistency, having daily habits where you work on yourself in terms of figuring out what you need to do. And I think the mindset is the most important thing in this. And I think develop a really, really good mindset where you know that like you're going to do the hard work every single day. Like you're going to, if you want to revise for whatever X hours, you're going to do that. If you're going to make notes on whatever X hour, you're going to do that. And I think building those consistent habits is going to be really, really important. And I think that's probably the most important skill I would say is having that mindset to be able to build on that, because I found dental school okay, but I think dental school is really, really tough. Like, I think really, really mentally challenging. There's so many exams. I don't know about your guys' dental school, but I had like so many exams, and it like really puts you through it. It really, really tests you. So I think having that strong mindset and that habits and the discipline that you've built, it's so, so important. So I would say that's the main thing that all people that apply into dental school need to focus on. And I'd say that's probably the most important thing. What would you guys say is probably more important, was the most important?
Yeah, I think I've got to agree with you. I think like resilience is the most important thing, and like just having like trust in yourself as well. So I think it's very easy to compare yourself to others, especially in school when like you're like when the teachers literally like isolate you. You're like, okay, you guys are all applying to dentistry, and like you have to like you just end up comparing yourself subconsciously. And obviously there's student room, which is the bane of my existence in year
Never
13. Like
go
I literally
there.
remember,
Yeah, like straight after exam, like, okay, what
Yeah.
do you get?
but even like right after I sent over my application, I remember I'll be checking each thread for each dental school that I applied for, like continuously. Like, every day I'll be checking just to see if anyone has received interviews. And I think like you need the resilience and trust in yourself, because then you're just gonna put yourself in like a really bad like mental place, and you don't want to be there when you're like doing interviews or like even when studying for your exams. I think it's very easy to get sidetracked with the application process and put less focus on your exams, when in reality the exams are the thing that's going to carry you to the end. Like you can always reapply for dental school the next year, but if you like don't do as well in your exams, you can obviously retake A levels, but I think it just makes the process more complicated. So I think just resilience and having trust in yourself and just not comparing yourself to others.
I think I
Uh,
actually really agree with that because, like at the end of the day, the people who are on the interview panel have been doing this for like years. They can smell BS from a mile away.
Yeah,
So
absolutely.
they would know, like, and there's a lot of people applying, so they know who's actually in it for the right reasons. Again, I think we can talk more about this, but like, I think a lot of people go into dentistry for the wrong reasons.
Absolutely.
And I think a lot of people realize whilst they're in uni, after going through that whole hurdle, they're like, I'm stuck in this. Because it is a very, like, what's the word? You know, when it's like vocational degree, right?
mhm.
So if you're going into dentistry, make sure it's for the right reason. And number two is like, I don't know, you just got to be different. And if you fail the first time round, it's genuinely not the end of the world. Like taking a gap year at the time at like 18, you might be thinking like, oh my God, like I'm wasting a year. Everyone else is going to uni. What am I doing? Genuinely, in the grand scheme of things, it probably will benefit you way more because you can pack in your CV with a lot of stuff that year. So yeah,
Yeah. If you're doing dentistry for the money, forget it. Like, there's so many better things that you can do with your
Mhm.
life to make money than dentistry. Go into investment banking or something. Like, I've
yeah.
had flatmates that I spent time with in year 4 and year 3 who were miserable doing dentistry. They knew that they chose the wrong career for them, but they were like, I'm in 4th year, I'm going to finish it now. They're like, oh, I chose it for the money. Now we're working, and I'm thinking like we are earning good salary, we're earning good amount, but like there are so many other things. If you just wanted to make money and you didn't care about the helping the people, you didn't care about the patient report and making an impact in people's life, don't choose dentistry. If you're purely doing it for the money, I've seen a lot of people that absolutely hate it and the money's not making them happy. for what they're doing. So choose something else if money is what dentistry is bringing you.
I think even if you're unsure, I think it's best to just take that gap year and just rethink. Or even in dental school, this might be a bit controversial, but if you find that it's not meant for you, I think you're better off just leaving, like dropping out and starting a new course. Because at the end of the day, once you graduate the 5 years, it's not over. You have a whole lifetime of being in this career. And if you don't enjoy it in dental school, you're not going to enjoy the rest of your life. So it's best to just like take a breather and just like go find what your true purpose is or what you really enjoy.
I think it's to say, like, I think not everyone has the best experience in dental school. Like, I wouldn't say I had the most brilliant experience in dental school. And I think a lot of people will think, okay, since I've had a rubbish experience at dental school, that means like the career is going to be kind of rubbish too, which I don't think is true at all. Because like me and Lance are working now. So Lance, what would you say dental school, how is it different to like your working life?
I think I had contrary to what you said, I had an amazing time at dental school. Yeah, so I thought my dental school was amazing. So my experience at dental school was really, really good. It was very, very tough because we had exams sort of so frequently. But I felt because of the clinical exposure that I got from dental school, I felt very well prepared when I was coming out into the real world. Again, in dental school, you're taught to be a safe beginner. So your hands are held, you check, I remember the times you're like doing an access and you're like, before you even drill, you ask the supervisor, am I holding the burr at the right angle? Am I going to perforate? You're like asking, can you check my rubber dam? Can you please check I've given, the numbing right? And, you don't get that once you get out. You're a safe beginner at that point. So I think that transition is quite different, but I've had an amazing ES. So ES is an educational supervisor that you get in your first year that you come out, who's there to support you and support and mentor you as you go through. So I've still had that sort of spoon feeding a little bit, but everybody's experience is a little bit different. And I think I sort of flourish when we have someone looking over me a little bit here and there. So I think, yeah, I've had that good transition from dental school to sort of practice that I'm currently in now. But for me, I found dental school really, really tough because of the exams, but I absolutely loved it. How was your experience, Michelle, and how was yours?
Oh my God, I don't want to flag things. No, as in like dental school was fine.
Yeah.
I think it was more to do with expectations from the institute.
Mm,
Okay.
Even like we were like going through COVID, but we were still expected to get the same clinical numbers, clinical experience as pre-COVID. So I think I was like a student advisor as well, a student ambassador, one of those. Academic rep. Yeah, I was academic rep. I remember being in talks about how we can try and facilitate for the current situation we're in since things have changed. So like, let's try and adapt. I don't know as well. And like, I think in dental school, there's a lot of pressure to kind of be perfect. I don't know what your opinion is, but first of all, you're doing microsurgery essentially in tooth.
yeah.
So a lot of dentists are going to be perfectionists. But then to be in dental school, you are expected to get things right. And like nobody's perfect at the end of the day. You're going to make mistakes here and there. So I think it's important not to like get too in your head about it. Comparing yourself is not a great mindset to have. Obviously, like, look at what other people are doing, take it in, reflect, improve, but don't take it in a way where you're like, oh, what's wrong with me?
Yeah. Like it would
Yeah.
eat you alive. It would absolutely eat you alive because there's always going to be someone that's better at you at something than you are. And the more you compare, like it's as cliche as it is, comparison is the thief of joy. Like you might have done 80, you might have got 80% in your exam, but someone might have got 85. That doesn't mean you didn't do well. You did really well in dental school to get 80%. If the highest mark was 85, but that person has just got 85%. If you sort of compare it to that and think, oh, I didn't do as well, he got 85%, you're going to be sad. But use that as motivation to, maybe I could have improved X, Y, Z. I'm going to do this a little bit to get better. But if you compare it to other people, I think that's with everything in life, isn't it? That someone is always going to be richer than you. Someone is always going to have a bigger house than you. Someone is always going to have a better car than you. So whenever you compare with someone else, you're never going to end up sort of happy. So that's a sort of motto, like we said, we live by.
Yeah, I think I can't really talk much about my dental school experience as I'm only 3 years in. And I feel like third year is when I feel like I'm actually in dental school. Like the first 2 years was very all fun and games, just lectures, a few like clinical, like phantom heads every now and then. But I think now that I'm in third year, I can actually I feel like it's more hands-on. So I feel like I don't really, like, so far I'm enjoying it, to be fair. Like, I genuinely do love going to uni, on most days. But I feel like only when I'm in 50, I'd get to actually have like a proper view of how my dental school is or how I am finding it.
Michelle, I don't know about you, but I wish I could go back to dental school. I'm like,
Really?
yeah, I'm like, well, I think when you're in dental school, you're like, I need to graduate. I need to start earning money. Like, when am I going to graduate? Now that I've
Yeah.
graduated, I'm like, I kind of wish I could just chill out. And the only thing I have to worry about is just, going to uni the next day or a written assignment or like the ADK. But I miss dental school. But I think, what do you think, Michelle? Do you like how it is?
I kind of prefer it now because
Okay.
I feel like clinically, my uni was really good. I think I like the independence I have now when it comes to work. I can make decisions, I can do things, I can see the results. I have my own relationship with my patients. It's very different. I will agree, like social life has kind of like died down
Yeah.
since uni.
Yeah.
But saying that, I do feel like when you go out to work, you mix with all sorts of people, and I think I like that. But you know what? I do think what I took for granted at uni is like the resources, like the people who are teaching you are like the best of the best. And I don't think you realize that at the time. So it's like, savor that.
Enjoy it. Enjoy the next couple of years.
Yeah.
I will. Do you guys have any tips for like students right now in dental school?
Start off, Michelle.
But I'd say respectfully, make as many mistakes as you can now. And don't hesitate to ask like your clinical tutor to give you feedback. You might, again, it's all about mindset at the end of the day. They're going to criticize your work, reflect, move on, do better kind of thing. But make as many mistakes as you can now. Because like when you go into practice, you're paying the lab fees, like you're the one who's like the front face for patients to put complaints about. It gets very, I don't know, real like when you start working, whereas in dental school you're very protected, very protected. Try and get onto projects in dental school as well, like you're surrounded by like academic staff as well, so that'd be great. That's something I didn't do as much as I wanted to do, but I'd recommend that for sure.
What do you mean by projects? So like research projects, like kind of get involved in their research?
Yeah, so like research papers, audits. Obviously, most of the time it won't be like you go and do it. It would be like a professor or a doctor. They would already be starting off a project, and it's good to have like your name on there, so you can use that to showcase when you're applying for jobs, or like if you're thinking about specialty training, like that you're actually more involved rather than just doing your baseline work. Yeah.
I would say build your communication skills. I think that's, for me, the most important skill in dentistry personally. So I'd say you have a lot more time. When I was in dental school, I had 3-hour appointments with patients. Use that time to really, really understand how to communicate, how to understand a patient's pain point. What are they here for? What would make a difference for them? And really get to know them. And you as a clinician will get more comfortable with speaking, knowing how to communicate certain things, how to come across in a way that's, beneficial for the patient. I think that is what dentistry is all about. Communication. I think it's 90% communication. That's, if the patient understands the risk and benefits and they can make an informed consent, it's the biggest thing. But when you get out into the real world, you don't get 3 hours for a patient. You have to be able to, concise everything and say it in a way where the patient understands everything, but you get 15 minutes, 30 minutes to do that. So while doing the treatment. So I think if you build your communication skills up at dental school, it will pay you dividends for the rest of your life. So I'd say get really, really good at communication would be my biggest tip at dental school when you've got the time.
Wow, these are
Which is
really good tips.
kind of controversial, but do you think, I remember like my first ever clinical session, um, the clinical tutor was like, every single time you enter a clinic, you're basically on a stage. You're role playing, you're performing. What is your opinion about that?
I think it's absolutely true because we, as clinicians, we wear multiple different hats, right? When you have a patient that's walking in, if you're seeing 20 patients a day, not all 20 patients are coming in the same mood, right? So one might be really, really anxious coming into the chair. You've got to manage that. Someone is really, really ecstatic. Oh, I've just had an amazing day at work or whatever, and they're coming in. Someone's in agony, in pain, crying. You've got to manage that. Someone is really annoyed at the receptionist or they're running late and you're annoyed, they're annoyed. So at the end of the day, there's so many different skills in terms of managing emotion that you're playing at the moment. You're playing, like you said, it's role playing. You're putting on so many different hats. You just got to be on the spot, be able to make a quick change. It's like as soon as the nurse introduces, oh, welcome, you're going to see Dr. Lance. Hi, how you doing? You like suddenly just change up your mood. And like, you could have been really, really stressed out, really annoyed, running late. But as soon as a patient walks in, you put on a mask and you're happy and jolly and you're like, I'm here to help you. I'm here to serve the patient. So I would absolutely agree with the tutor that said that, like, you are on stage, you're on role playing. And that's why I think dentistry is so exhausting. Like, I sometimes come back home and, sit and have dinner with my family and I'm like, that's it. Like, I can't talk anymore. I'm going to go and sit by myself for a bit. Like, I don't know who else feels that way, but I definitely feel socially absolutely drained. Like, after talking for 8 hours straight at work, I don't want to come back and talk anymore. Like, I've had
Yeah.
my time. Yeah,
Yeah, it's because like you said about like communication, right? That is the main bulk of the job. Imagine having to manage a lot of people's emotions, switching up, you're responsible. Like, and I'm not gonna lie, like there are some challenging patients out there, and just knowing how to handle those kind of situations, it's fine in the moment. And then I think for me, it's like as soon as I walk in through the door when I'm at home, that's when it all hits me, like how fatigued I am. And then you've got to be back up ready, starting fresh for the morning. So, but again, it is about how you need to learn how to manage that. And I think you learn that through dental school as well. Yeah.
absolutely. How have you
What is
found communication, Ghania? How have you found it at dental school so far?
So, as I mentioned, only just properly started seeing patients now. But I think, yeah, I get the thing with like, you kind of have to adapt to each patient because even from like the limited experience I've had, like, I do find myself like faking a persona for each and every patient. And like, sometimes, like, if like the patients are more challenging or they have very specific views that I don't really align on, it's best to just like agree to everything they say and just like, or just ignore it and like move on to a different topic. Cause I feel like sometimes I remember I had a patient once that came in. He was quite old. He was around 90 years old. And like, I did not agree with everything he was saying, but I just pretended I did agree. And like, I was just trying to like let him speak as well. And at the end of the day, he literally was like, you're my favorite dental student. So I think, yeah, communicating is so important. And like, it's best to like not let what patients say to you, like get in your head and just like move on with your day. Cause at the end of the day, like you can't really control your patients. You can't change people's views or perspectives. The only thing that you can do is that you just try and be there and listen to them and just listen to what they're going to say and just kind of keep an open mind, I would say.
Michelle, I don't know about you. Do you feel this way? But like, you cannot take anything in dentistry home. As soon as that surgery door closes, as soon as it finishes, you leave everything at the practice. Because if you
Yeah.
take anything home, it's diabolical. You're going to be stressed out. You're going to be like, oh, what could I do? Like, that's bothered
Yeah.
me, or the patient was rude to me, or they were rude to my nurse. It will just eat you alive. Like I said, work is work, home is home. You never mix. You don't mix
Yeah.
them because it's a nightmare. How have you found that, Michelle?
I definitely learned that in uni because I'm the kind of person who like worries a lot about a patient. Even if I've done my best and they're completely fine, I will still nitpick. Like it goes back to the perfectionist mindset. So I think in uni when we were like responsible for our own patients and I'd be like, oh my God, did I forget to do this test? Or like, is this a correct diagnosis? Even though this is all checked by a clinical tutor, by the way, you start thinking about that. And I think through the years, I managed that better. So when I got to FD, foundation year training, yeah, I was pretty good at not taking work home, to be honest. It's slightly different now because I'm working a max fax job where it's very different to general practice. So as much as I don't want to bring work home, it does follow me home and kind of expected to follow it home. Yeah.
That's the hectic lifestyle of being on calls, isn't it?
Yeah, for
Yeah.
sure.
What is one like experience that you've had with a patient that's like really stuck by you?
That's a really good question. I would say that would sort of go back towards my patient that I saw in year 5. So final year of dental school in Peninsula Dental School, where I graduated from, you have to do a final case, is an exit case where you have to have 3 different modalities. And I had a patient who had like a stumped root that was like basically needed to come out, and gaps in her teeth, and needed a couple of fillings. And because of the time, we said like you spend 3-hour appointments with your patients and you see them so frequently, you build such some amazing, rapport with them, and you get on so well. And to come, see the full treatment, at the time when you're in dental school, you don't sometimes see the full course of treatment for the patient. But for this patient, I did everything. So from the perio, which is a treatment, to restorations, to dentures, to extractions, and the healing. So a whole year worth of treatment. And at the end, you give everything, done the denture, cobalt chromes, you've done the filling, and then you see the smile and the impact that you've had on them. They start crying when you finish, and they give you a card, and you're like, this is what dentistry is. I can make this much change to someone's life. Money can't buy that feeling. When you got someone pouring their emotions in, and you've just completely changed their life, it's such a surreal feeling. And for me, that's been, hoping to emulate that more and more in the real world once we, go out. But I think for me, that's been an amazing, amazing experience. What about you, Michelle?
Ooh, the most memorable patient encounters. I think I dealt with a lot of patients in my foundation practice with dental anxiety. And I mean like hardcore dental anxiety. And then for them to even they would be like crying outside the door, or like a lot of kids would be like, really scared. And like I remember a lot of these patients were referred for GA sedation, like the dentist before me. Again, dentistry is all about patient management. So I think having that feeling of, what, you talk to them, you let them trust you, doing that work, showing that work to them, to know that you're able to do that without having to go through the extra steps of waiting, especially on the NHS list for station GA. I don't know. For me, it's like a very satisfying experience. Also, like correctly identifying cancer. That's I think that stuck by me as well. And then we have a similar thing as well in Sheffield, where you have to present a final case. So my first patient I ever saw in second year, I treated him from second year to fifth year. There's a lot of work that needed to be done. At the end of it, it's kind of like a similar thing. Like he was crying at the end, and this is like some kind of cold Scottish guy who I thought like, oh my god, like is he ever gonna like me? And then like by the end of it, it was like he felt like a granddad. Like every time he would come in, he'd give like little bits of advice, just generally about life. So it's like you have got the time to talk to your patients and like take advantage of that again. Yeah.
Do you find that sometimes like you care too much about your patients? Like, when they tell you about their their life, like even now I feel like sometimes I empathize a bit too much, where like I just like I don't know what to say. I feel like I'm not I think this comes down to communication and me needing to work my communication skills. But I feel like when I first get hit with these stories, my first like instinct is to go like straight into like myself and just start like emphasizing with them and like starting like to like I guess help them in a way, or like just letting them talk about it. But do you think that is the right way to go, or do you think it's better to keep a more professional approach and try to like stay away from like personal stories? I don't know if that made any sense.
It's a balance, I think. The balance is so, so key in that. I think you are a professional at the end of the day, so you have to have that professional sort of boundary where you think, I can't, this is professional and this is where it's going to be. But you are also a human being at this point of time. So I'm in a very high needs area for a practice, and I have patients who are, drug addicts who have just come into social housing. Had a patient a couple of weeks ago who's in a social housing, drug addict, went to prison, came back, and his neighbor, who is also just came back from prison, died, banged his head, died, 3 days, and no one checked on him, and he just was like, I'm smelling something, so I called the police. And like, you just think like, that's something to just throw out on a Monday morning, isn't it? Like my neighbors who are living together have just died, and you've got to figure out a way to sort of empathize with them. And they're obviously traumatized, and you're a little bit traumatized now because they're also telling you all of this. But there is a little bit of a balance in terms of, you have to empathize, that's part of your job, but you can't go into like, oh, I'm gonna make sure you're okay, call me or whatever. Obviously you can't do any of that, but there's a balance in terms of, as a professional, you have duty to look after your patient, but also like be professional about it.
And that's really good advice.
Can I add in a bit?
Yeah.
Like, just remember, you can't save everyone. Like, you're there to, like, but you can't save everyone. Like, everyone's got problems and you're there to listen and advise, but only up to a certain point. Like, keep it within some kind of boundaries because it can bite you in the future. Yeah.
Absolutely agree with Michelle's point. Like we have patients who are like very, very, very young and they've got decay in every single teeth. You ask their habits and they're drinking Coke every single day. They're having like 5, 6, 7 snacks a day. And you tell them, 4 sugar hits per day. Make sure you brush twice a day. Make sure you floss every single day. And like, you just know, you see them again and like, have you made any changes? No, they don't care. And like, you can repeat this every single time, but some people genuinely don't care what you say. They don't care about their teeth. They don't care they've got decay. And like, whatever you say goes in one ear, comes out the other. Like, for those sort of patients, you as a clinician just can do your best and reiterate oral hygiene, approach it in a different way. Maybe if I say it in a different way, maybe if I demonstrate, show them why are you not listening? You can try all these things, but some people just genuinely don't care. And like you said, you can't save everybody. You just try your best as a clinician, and that's all you can really do.
If you're enjoying this episode right now and you find it really helpful, it would mean the world to us if you could just follow or subscribe wherever you're listening and share it with someone that you think that this would be really, really helpful for. That way we can bring on more and more guests and share more of our stories.
Controversial question.
Go for it.
What is your opinion when people, I've heard this a lot from medics, when they say, oh, it's just teeth. Like, what's the big deal about it? That's what your job is, just teeth.
Okay, that's a good point. But I think everything starts with the mouth, right? Oral hygiene starts everything. If you've got so many diseases like perios linked to heart disease and all these things, I think if they say in terms of teeth, they're comparing life and death to teeth. Of course, if a patient is not going to die from any of the treatment that I'm going to do, patient's not going to be severely sort of like, in medicine, like pass away or something sinister, but it's an impact that you're having. You're changing someone's life. They've done a study where if you chop off your eyebrow, you cut it, or you lose a teeth, which one do people notice first? It's the teeth they notice first. You give someone so much confidence. That's money can't buy that, to give someone a social interaction, that confidence. And I think that, we have this sort of debate between medicine and dentistry, like what's better and what's not. And like, I always say to them, there is no need to be comparison. We both have a beautiful career. We're both serving patients. And that's the way we will look at it, right? I don't want to compare to what medicine does, because I think that's a beautiful career that you do. And what we do in dentistry is also another beautiful career. We don't ever have to compare. We work together to look after the whole holistic body. And I think that's the way we should approach it. I think most of the time the doctors are just sort of envious because we earn more than them. But at the end of the day, it was the same entry requirements, same grades, but we chose dentistry, you chose medicine. So you live with what you chose.
Okay. And then I had another controversial question. So again, a lot of people, and I mean medics, kind of say, oh, why are you guys called doctors? What's your opinion about
This
that?
is a good one.
That's a good question. So what would you say the term doctor means? What would be your guys' definition of a doctor?
It's a title.
Yeah, it's a
Yeah.
title, right? So we're serving a part of the body. So when you have within medicine, you have different sort of specialities. You've got people that specialize in the eye, specialize in, different parts of the body. We specialize in teeth. We specialize in oral hygiene or oral health as a whole. So we look after the mouth, the head a little bit, and the neck area. So that's what we specialize in. To be honest, the title is nice. It's great to have. And I think it's an amazing thing to have, but it doesn't I don't really get that bothered by it. I don't really get that sort of flustered by it if you don't use it. But I think it's for them, it's a bit of envy on their side, I guess, maybe a little bit, but we specialize in the oral region and I'm going to use the title that was given, and that's it really. So you're a doctor. If you're a GP, you generalize in everything. We specialize in the mouth, and that's the difference. We're both called doctors. You can take it up with GDC or GMC, whoever they've given us that title. But when I was awarded my degree, it said doctor. So I think I'm going to take that and run away with it. What would your viewpoint on it, Michelle? What would you say?
It goes back to history, doesn't it? Like,
Yeah.
I think medicine and dentistry, like, you need to look at the history of it, how dentistry became, I'll say it was barbaric practice, and it became surgery. At the end of the day, you can be also a doctor of, I don't know, like, of music or something. Like it is
Yeah.
a title at the end of the day, and I think we respectfully should be called doctors because the amount of stuff we learn in dental school is not just teeth. Like I don't know, Lance, how was it for you? Like in first year, our first year was
The whole
predominantly
body.
whole body. We had to do dissection ourselves on cadavers. It was like proper, like I'd say medical training. Yeah, we didn't go into like medical placements, but for sure. And like third year as well, we had to like learn more about medical specialties. Is that the same for you?
So we looked into sort of all the body parts, not into extent detail, but we needed to know what each one was, how they worked. And like I said, we specialize in the oral region. Doctors specialize in other parts, and that's the difference I see it as.
Do
Loving
you
the
think?
controversial questions.
Sorry, I just I would really like to know what people like would make of this. But like, do you think being a male is makes it easier to be in the dental field?
I think I would flip that question and say I think it's harder to be a male in the dental field. If you look at the statistics, there's like 75% of dentistry is females or 70% of dentistry is female. So I think every time I now go into, I'm like one of two people in the hospital that are in the dentistry department that are male. The rest, from all the consultants to all the regs to all the nurses, they're all female. But I wouldn't necessarily say that's restricted me in any other way. I just think in terms of demographic pool, it's just more females in the dental field than there are males. But I wouldn't say, I can only speak from a male's perspective. It hasn't sort of hindered me in any way. I still feel like I was able to achieve everything I wanted to achieve. I still had the same opportunities that I wanted to achieve. I never felt like something, stopped me from achieving anything. So from a male's perspective, I would just say it's been different because I'm one of the few people that are males in a department that I work in. What would you say from a female perspective then, Michelle?
I mean, to be honest, like in uni and like some patients in my foundation year training, they did say some pretty sexist stuff. And another thing I noticed as well when I was in practice is a lot of patients don't take females seriously, even though we've got the same qualifications, sometimes even more experience than a male colleague. They don't view you as that. And again, like back to my Max Facts job, the amount of times I've been mistaken as like a nurse is like, yeah, it does get on my nerves because I think like people need to start changing their perspective on like what females can do. What's your opinion about that, Lance?
To be honest, I can only speak from my
Yeah.
experience. I think
You've got
I've
a
had.
sister who's like,
Yeah, she hasn't told me anything about in terms of how that is in medicine at the moment. But I think I've built that sort of rapport and sort of trust and that community build with the people that I work with in hospital. But I think all I can say from a male's perspective is that we're a minority in the hospital, but I've not feel like that's hindered me in any sort of way, but I haven't come across what you have obviously stated, but because I don't work in MaxFax or anything like that. So maybe if I worked in MaxFax, I might be able to say, you know what, you might be onto something.
but to be honest, like I've experienced it from patients quite a bit.
Okay.
More so, yeah, I'd say more so with patients for sure. Yeah, let's not get into that.
Interesting.
Okay, this is gonna backtrack, but I heard you came to the UK when you were 8. Is that true?
Yes, that is true. Yeah.
Like, tell us like what was going on around that time.
God, so this is taking me back. So yeah, I came to the UK when I was 8/9 years old, and we left because of the war. So we left Sri Lanka during the wartime, and then the war sort of happened, and then we came here, and we obviously looked for. My parents did everything really, as they would do to find a better life for us as kids, and for that I'm so grateful for because they've sacrificed everything for us to get here. So I think coming in here in like say year 4, year 5 time was super difficult because I barely spoke English and like it was like you have to adapt. And I think that was okay because I was only in year 4 and year 5 and year 6 time, and it didn't really matter that much because there wasn't like life-changing exams or anything. But obviously, you're living in 30-degree country back in Sri Lanka where like the milkman comes in the morning to give you milk. Everything is fresh, and like you have a sense of community. Everybody talks to each other. You have cows walking on the road, and like you come here and like, where am I? What is this place like? It was a very big transition for me, and you obviously had to learn English very quick. You have to adapt, and move on. You got given a better opportunity by your parents, something that they, didn't have, and you got to take the most of it. And I think that's why I'm forever always be grateful, because for me now it's like I'm in a position where it's stable. I've worked hard to get to where I want to be, but now it's for me to give back, for all the work that they've done, all the hard stuff they've done, forever be grateful. And for me, it's to give back. And I think I look back at that time and I don't think I could do it again. And I think naivety played a really big role in that. I didn't know what was going on. If I knew what was going on like I do now, I think it would have been really, really challenging and really, really difficult. But because I was so young, didn't know what the world was like, didn't care. It just happened and you just slowly transitioned into it. But, you know, here we are and we're better for it. And you build on those lessons, you learn from those lessons, and it just makes you stronger for it. So.
Yeah, it must have been really hard to like adjust the whole new like continent, whole new lifestyle and everything. Did you struggle with like English? Because like I feel like your English is great, like even better than mine. To be
Yeah.
fair.
Yeah, I learned English in 6 months. So I came here and I just thought, well, I need to learn English, just bang it out and just learn it,
Mm.
learn it, learn it, learn it. But I think I had it pretty easy, I would say, because I felt like I came here enough time. Whereas my sisters, they were in like, I think maybe like year 10 or year 9. And it was like really crunch time because GCSEs around the corner. And
Mm.
like for family, like my parents to adjust to the new lifestyle, you're so set in everything, how it works. And then suddenly you're like, you have to leave everything behind and go. I think for me, it didn't affect me as much because I was so naive. I was so, I'd say 9 years old, 8 years old. You're young, even though you can remember things. But I've had an amazing, amazing support group around me. My family's always been there, and we pushed each other, we help each other. We now in a position where I can hopefully help them and look after them. So it was a very, very challenging time. It taught me a lot. It matured me a lot. I learned a lot, but you know, everybody's life is different. You can't, you got to make, like Michelle said at the start, what life gives you, like what you want it. So I think I'm in a great position now where, like, so many other people would have passed away at that time during the war. I'm in a position where I'm here. The unlucky ones are gone. They're not here with us. So I'm in an amazing position where I was lucky. And I think for me, I have to make that impact and positive change because I'm the lucky one. So for me, it's now giving back to the people.
Was that like 2009-ish you came?
Yeah.
So that was
Yeah.
like wartime,
Yeah.
right?
2008-ish December time we left. Yeah. Yeah.
Did you
So
know kind of like around that age what you wanted to do with life, or were you just literally trying to survive?
no, I think I was, so in Sri Lanka, I think my mom probably wanted me to do medicine at the time if I stayed there in Jaffna. But once you come over here and you sort of transition into, like, my parents don't know how things are here. I don't know how things are here. So it's something that you learn and something that you have to adapt to. And I think that was quite difficult because it's a complete new life in across the world, in a first world country from a third world country. Like, I grew up in times where you didn't have electricity. You had to use a candle to study. There was curfews at 6 p.m. and you hear you see all of these things. And we were the luckier ones. We didn't have it as bad as other people did. But you still see those things. You still hear those things. You still see that you're in that sort of environment. And then once you get here, it's like you're living life on a palace, like lavish, because you compare it to that because you've gone through sort of all those horrible times. And I think that's taught me so much and it made me the person I am today. So I never let like little things ever get to you because, you've come through so much and like so many little things now, they don't bother me anymore. Like, you've gone through all of that. And I think that's why, like, you make it what it is, right? That could have really, really traumatized someone. That could really, really like damage and make them, but we can also uplift you, give you the skills. And I think God had a plan for me. So here we are now. And I think you just build it up from there.
Have you gone back to have you done the Sri Lanka trips?
So I have not been back since 2008 and I'm going back in January to give back. So we're doing a trip in January. So we're going back to a couple of places to do charity dental work. And I think it'll be a very, very surreal moment for me because it's been almost 16 years having stepped foot back and be able to give back to the community, the people, and, help those people that are less fortunate than we are in the position we're in. Like we always say, we're all very, very lucky where we are now. And not people even back home are not so lucky. Like, there are still people that don't have food, don't have homes, homeless, orphans, widows, and, don't have any access to education or healthcare. And I think that's the impact that we want to make. Well, personally, I want to make is be able to give back, and through BTDA. And I think that's the main focus of BTDA, is to be able to give back and sort of, we're privileged, and give all of that back to those people back home. And I think we're heading in the right direction. So I'm so excited to go back and provide all of that work.
Yeah, that must be so exciting, but also nerve-wracking. Are you nervous to go back? Like, do you think
I
it's
think
gonna
I've grown past. Yeah, I think I've grown past it a little bit. I think it hasn't hit me so much, but maybe like once I land and like I smell the sea and I
yeah,
can feel the sun, I'm like, oh, maybe now it's a little bit different. But maybe I'll be a bit teary when I land or something like that. But at the moment, I feel calm. I
yeah.
feel so excited to go back. But I think probably a lot of emotions will hit me back then when I go.
Mm.
But obviously, you're just super excited for that time. So I think I'm really looking forward to it.
Do you think you would visit like your old home and then go around back like to your
So,
area where your family
but my
are?
grandparents still live there, so everything is still fine. So they still live there, so everything is all good. We weren't affected. That sort of part of Jaffna wasn't affected as much by the war, so we were, like I said, very lucky. Everything is still intact, and everything is still sort of in its place. Where a lot of other parts of Jaffna, other areas that were really distinctly affected by the war are not. So I think this time around, probably not, but we're going again in summer as well as a bigger BTDA group. So I think around that time, when we go for a little bit longer, definitely we'll go back. I think to be nice to sort of see the room I was in, see everything as a whole. I think it'll be a good memory to have. It's something I'll cherish, I think.
Yeah, I think it would feel very powerful as well to see how much you've grown from that like little 8-year-old to like now like a whole
Absolutely.
dentist, like a whole
Yeah.
doctor.
I didn't realize that there was a trip in Jan and summer.
So the one in Jan is just me and Milton. So it's just me and Milton. So we're going there to sort out a few of the bits beforehand for the bigger trip. So we're going there, getting all the resources, doing a bit of networking, getting everybody together. So then when we go as a bigger BTDA group, we have everything, all the structure and everything sorted out for us. So there's a lot of things going around in the background, which we haven't obviously set out. But once everything is finalized and confirmed, we want to make that trip as big as possible and something that's sustainable. We want to do this every 2 years. We want to make sure that we can sustainably keep going back, maybe even when we're old, but the younger generation coming through as well. So in order to make that sustainable, we have to sort of lay the groundworks first. So the January trip will be hopefully laying that groundworks for the bigger summer trip with a bigger group. And then from then on, just building that foundation for it to be sustainable in the future.
I remember there was talks about going 2025. Did that happen in the end?
So yeah, that talk, it didn't come through in the end because the first time around when they went, I think in 2023, I didn't go this time. It was more so oral hygiene because most people were in their 5th year. No one was really qualified at the time. And I think one person was qualified. So it was more sort of giving advice or cancer screening, just checkups. And I felt that we needed to progress more on from that. So to see now if we can provide some treatment. And it's really difficult getting registration back there, doing everything properly like we want to do it. It's difficult. It takes time. So we weren't able to get all of that done and across by the time we wanted to go in 2025. So the plan is we're working more on, rigorously and getting better connections to get that all sorted. So then we can do that in 2026. But regardless of whether we get everything, there will be a trip in 2026. That's definitely happening. So very exciting times for BTDA.
Okay. Have you ever thought about like Tamil Nadu?
We are. So that's
Oh, really?
one of the long-term goals. Yeah. So there's one of the
Okay.
long-term goals is to obviously expand, but you got to start somewhere, right? We can't say we've been to Sri Lanka once, let's start doing international and going off for different. We want to get somewhere really good, something that's very sustainable. Okay, now we've got Sri Lanka, everything sort of, not just the Tamil area. We want to help everybody in Sri Lanka that was affected. So you do that. We get that all sorted, everything is all good there, and okay, then we can now move on to another location and we can make it, as BTDA grows, the opportunity grows and the enthusiasm grows, and then we can really grow it more and more. So Sri Lanka is the goal, obviously, at the moment. Once we feel like we've got that comfortably sorted out, we can move on to, I think Tamil Nadu will be the next one after that. Is that something that you're passionate about to going back to?
No, it's just a thought.
Yeah, that was definitely one of our next ones that we were going to do. Yeah.
Would you ever consider like Malaysia? You know where like the Tamil populations are
Yeah.
predominantly.
So we have good contacts with a lot of people that we're currently with in Tamil Nadu and in Malaysia, but you got to learn to walk before you run. So
Yeah.
if we can't get Sri Lanka sorted properly, we don't want to now then go into, say, Malaysia or Tamil
Mm-hmm.
Nadu or anything like that. So I think we'll focus on getting Sri Lanka right. And I think then the opportunity is endless. Once we've got something successful that can continue to run, we can then, choose which areas, whichever needs the attention of BTDA, we can take that and move that forward. So yeah, super, super exciting times ahead.
That is actually really exciting. So Lance, as you're a board of director in BTDA, you must know all the background information and everything that goes behind the scenes. What do you think are the plans for the next few years?
I think it's an exciting time for BTDA. We have such an amazing group of people and such an amazing committee together. Everybody's so sort of driven, hardworking, and sort of wants the same common goal. I think we have so much planned and we're just in the process of sort of executing a few of the bits together. So in the short term, we have the Sri Lanka trip coming through. We're working on a networking event that's coming in next year as well. So we really want to feel like we've started to target a lot of the dental students and we've got a really good network within the dental student sort of region. But we want to now, as we progress in our career, we want to sort of get the dental professionals involved. Like, I don't know about you, Michelle, but I find dentistry is very, very isolating. Like, it's so like you're just in the surgery with your nurse and there's no one else. If you don't go out to these, conferences or these events, it's really, really isolating. So we want to get sort of networking properly done. So we're planning on doing a networking event next year. That should be something that's we're working alongside all the stuff that we currently do with UCAT, with interviews, and helping students get into dental school with our yearly conferences that we normally do as well. So the networking is the next big thing that we're really, really trying to get out onto the main stage. I think that will be something that brings the older generation and brings a lot more networking opportunities as well. But it also gets the younger students to have that platform of people that they can reach out. In dentistry, you don't look for a job offer. It's about who you know. Like someone will give you an offer because they know who you are for a job. So it's having those opportunities available for those people to be able to have that, but also help other people network as well. And other bit is to make the Sri Lanka trip very, very sustainable, to make that something that we can continuously do every 2 years. And building on that is to make BTDA bigger and better. I think building on some international trips like we were talking about with Michelle, but it all comes from the youth coming up, right? As we progress through our time, there's going to be more and more dental students, and we need more passionate, more enthusiastic people coming through to be able to sort of drive us and push us and come up with fantastic ideas to be able to push it going forward. What would you guys be interested in seeing BTDA do?
Yeah, I think the networking opportunity sounds really good because I feel like as Tamils, there's not much. We don't have a lot of people to look up to. We don't have a lot of family who are already in the field, especially as I think most of our family and parents have migrated from Sri Lanka, India to come here and they started fresh. So I think having a networking event would be so useful just to like even inspire the youth. Like I know that I would be so inspired and motivated just by hearing the talks and like just seeing all the endless possibilities that you can like turn your life into. But even to do with like, I think even for like dental applicants, I think all the interview workshops, all the like personal statement help, all of that is just really useful to just try get the students at the best competitive place to even get a place in dental school, as it is really hard. Like, I think as you mentioned, like dentistry is isolating and even in applying, it can be so stressful and just having that community and like having that feeling that you do have people that you can rely on and ask for help is what is like truly exciting about BTDA. And I think they are really doing well in trying to like build a community. How
I
about
think
you?
I agree. I agree with that. Wait, did you ask like what would you like
Oh yeah, I did
BB?
not answer that question right. Sorry.
It's fine. Well, I said, what would you want BTDA to do? What's your sort of, Michelle, what would you like to see out of BTDA?
You guys have done like quite a bit, I'm not gonna lie.
Yeah.
It would be cool though. I do think like once in a while, like, like other, how do I say this? Like imagine like there's like Afro society, like I don't know, like minority basically. Like it'd be kind of cool to see like minorities come together, like events, something like that. I don't know.
But networking with other sort of groups as
Yeah,
well.
like once in a while kind of thing. Like it just kind of like, again, dentistry is quite small. The population in the UK is small, right? So having Tamil dentists is like even smaller. So I think like networking with other minorities would kind of be a cool idea as well.
That's
That
a
is
really good
actually a really
shout.
cool idea.
Yeah, we'll put that forward and see. Yeah, just get the whole community and everybody together and see. We're doing that with BTMA, but we were saying like expanding it even more, isn't it, to get more out there? Yeah, absolutely. That's a possibility. Absolutely.
So just coming back to your social media account again. So nowadays, you must see there's a massive rise in dental students just making a social media account, even dentists just having a social media account and promoting their practices and their work. Do you think there is a specific or big advantage in having a social media account as like a dental professional?
I think social media is so, so important. We're in a generation where attention is the new currency. That's money. It's not money anymore, it's attention. You're fighting over, everybody's on their phone scrolling, everybody spends hours and hours on their phone. No one looks at billboards, no one reads newspapers, no one looks at papers anymore, no one looks at brochures. It's all on social media. And I think a lot of dentists have rubbish social medias, and I think that's something that people should, look into, and in terms of how to do better, because I'm no expert in social media, but I've figured out like what should be doing to improve and get better at. But I think social media is really, really important if you can utilize it. And you got to think, what are you trying to get out of social media? Is it that you are, tailoring it to patients, or is it you tailoring it to other dental professionals? Are you trying to make a positive impact? You need to understand who that target audience that you're trying to speak to at the end of the screen when you're recording that video. And the first sort of couple of seconds is so important. Like we said, it's a currency. Why does someone who doesn't know anything about you want to give you their 3 seconds of their time to look at your video? And that's the big question. Like, what did you deserve? You're not special. Why would someone, the media that I make, I'm not special. Why would someone want to watch me? Like, so you got to think so critically. You got to think what's making someone stop and listen. And I think social media is like something that I've fallen in love with. And I think it's a really, really important skill to garner. And the more and more I'm doing it, the more and more I'm learning, like, I'm rubbish at this, or I'm better at this, or that doesn't work, this works. And it's just trial and error. And I always, always say to everybody, it's like winning a lottery. Start your social media, just post, just post. It doesn't have to be dentistry related. We're obviously talking because we're dentists, but I'm thinking social media is such a avenue that's taken over. It provides so much value, so much freedom, so much flexibility that you can get into. And I always say, just have the confidence, like just to have the confidence to put the camera in front of you and just speak to the camera, showcase what you think, because you think that, oh, no one's going to listen to this, but there's going to be someone that feels, what you say is extremely valuable to them. And then you've just got to figure out how to push it in a way that more people want to see it. What could I do differently that will make someone stop and listen to it? But I think you have to be clear on what's your why. If you're just taking social media and saying, I'll just post social media, it's so flooded. No one's going to watch you. No one's going to listen to you. You got to know what makes you unique, what makes you stand out, and what are you doing it for?
What exactly do you mean by like bad social media?
I wouldn't say necessarily bad, but I'm saying like it depends on what they're wanting out of it, right? So I see, let's just say for dentists, I don't know what their sort of preference are in terms of what they're trying to reach, but I see lots of pages with just loads of teeth. And like, that's great if that's who you're trying to, your audience is dental professionals, or like that's a portfolio of work that you want other dental professionals to see. But if you give that social media account to your parents or to your family members who know nothing about teeth, thinking about, what is this? Why can I see gums? Or why is this so retracted? Or what am I looking at? I just see a bit of teeth. So that's what I mean. Like, you need to know what your audience is. And I see a lot of lots of reels that come up. Hi, my name is, no one cares. No one cares. Like, if I started off by saying, hi, and my name is Lance, someone's already clicked off it. No one cares I'm Lance. No one cares enough to give me that time of day for 3 seconds to say what I'm going to say. It's like I said, it's a currency. But again, everybody uses social media for different purposes. But if you're sort of figure out what you need to work for and what you're working towards, and then you can target it towards that niche.
I think that's really helpful to anyone who's interested in making a social media account. So just the end of the podcast, we always end off with a fun little question. So what would you say is your favorite Tamil meal?
Or Tamil meal. I think that's quite easy. Kotroti probably will be my favorite Tamil meal.
Which one? Mutton, chicken, or veg?
Oh, it's definitely chicken.
Okay, yeah.
Definitely chicken, yeah. What about you guys?
This is such a hard
Put you on the
question.
spot.
Probably gonna say like, okay, dolphin kottu.
Dolphin?
Oh,
No,
like
okay, so
dolphin.
it's called dolphin
Okay.
kottu. But
Okay.
it's like, I think why it's called that is because it's like larger pieces. It's not like super chopped up. It's like
Oh,
large
okay.
Okay.
pieces. Yeah, so they kind of like
I've never
resemble.
tried that. Where have you like got this from? Is it like at a shop or does your mum make it?
No, like they literally have it in Sri Lanka. It's literally called dolphin kottu in like
Wow.
I've not come across that. Okay, I've got to
They're
try
like
it then when I'm
big
back.
size, I'm not
Okay.
making it up.
Okay, I'll try it when I go back then. I've
Yeah,
never heard
That's
of it.
sick. Yeah, mine's
Yeah.
probably uppam. I just can't get enough. Like this sweet uppam. Sweet. Yeah. So thank you so much, guys, for listening. And thank you so much for Lance for being our guest today. This podcast was really useful and really inspiring. And we can't wait to see you guys the next one.